welcome to La Vida Las Vegas podcast. We're two physical therapists living the life in Las Vegas. I'm Dr. Erica.
And I'm Dr. Joe. We created this podcast for two reasons. First, to connect the healthcare, wellness, and fitness communities in Las Vegas. And second, to highlight all the amazing people we've met along the way.
Thank you for listening, and remember to take care of yourself.
Today's guest is Antoinette Gagliard. She is a pelvic floor physical therapist who works out of the Las Vegas area. She speaks with us about common pelvic floor issues, when to see a pelvic PT, and her love of Vegas food. Welcome to La Vida Las Vegas podcast, Antoinette. We appreciate you being on the show.
Thank you, guys.
So,
thanks for having me today.
Absolutely. So who are you and what do you do?
My name is Antoinette Gagliard, and I'm a pelvic floor physical therapist. I work for Select PT in Las Vegas.
So what is a pelvic floor physical therapist compared to a normal physical therapist?
So just like most physical therapists that evaluate musculoskeletal injuries and things like that, I do the same thing. So I look to see how somebody's muscles of the pelvis, internally and externally, are functioning, and depending on their diagnoses, I treat stress urinary incontinence, urge urinary incontinence, mixed incontinence, constipation, pelvic pain or painful intercourse. Some patients with chronic pelvic pain conditions like endometriosis, I treat those too. So as a physical therapist, as a part of their care, I'm just looking at how are their tissues moving, how is their pelvic floor muscle strength, endurance, are they able to relax those muscles when they do these functional activities like make bowel movements or have intercourse. So that's the kind of thing I look at.
So what started your interest in that? Because you and I met in the more traditional outpatient setting that people are, I'd be saying, more used to. What made you decide that you wanted to go with pelvic floor?
So when I was first in school, I became interested in pelvic floor just because I've always been interested in the systems physiology part of things. So when I found out that pelvic floor was a specialty that incorporated GI, reproductive, urology system, and musculoskeletal, neurovascular, all that normal stuff that PTs look at, I was really interested to kind of learn how to specialize and talk about how all of those systems work together. It just gives me a lot to learn and a lot to educate on. So I really enjoy that aspect of it. When I first was in grad school, we took a kind of a short intro to pelvic floor type of course, and I really enjoyed that. So then I did it as a part-time clinical, and then I did it after that as a full-time clinical. And to do the full-time clinical, most schools will require you to take the level 1 course, which is kind of like a continuing ed course, but you can take it as a last year physical therapy student. So either with APTA or with Herman and Wallace, those are kind of the two main vendors that teach the basic pelvic floor techniques, how to test people's strength, muscle endurance, coordination, tissue tension, nerve tension, all of that kind of stuff for this area of the body. And when I took that course, I definitely fell in love. So I figured that at some point I'd be going back to pelvic floor PT.
So what brought you to Vegas?
I love the weather and the climate. There's nowhere as beautiful as Las Vegas. It's very accessible, so I love that part about this city. And especially pre-COVID, there was a whole lot of fun stuff to do for me because I really like entertainment. I really like eating. Vegas has some of the best restaurants and had a lot of shows at one point.
How do you feel about brunch?
I love brunch. That was also one of my very favorite pre-COVID things to do. I can still brunch some places. Brunch is great. Again, mostly because of the weather.
People brunch pretty hard out here. I was really impressed for some of the people that I've met. Like that's a whole thing.
Brunch is very important in Vegas.
It is. So what else do you like to do in Vegas when you're not working as a physical therapist?
I would say I really actually like just reading related to physical therapy, studies that come out, and just looking at the courses I've taken. I'm super interested in my specialty, so I enjoy that a lot. But outside of work-related things, probably just the simple stuff like taking a jog and taking the scenery in is really nice. Again, the weather, the scenery is so beautiful. So as much time as I can spend outside is the better.
Where are you from originally?
I'm from Boston, Massachusetts, Boston area, so Walpole.
Are you Dunkin' Donuts fan?
Well, I was when I was in Boston, but not anymore. I've made the switch.
Two?
Well, I like Starbucks. I like Coffee Bean. I really, actually, I would tell you that's my main hobby is going around and just checking out coffee places that I've never been to and don't know what they are, not a chain or something like that, and just taking a couple books and doing some review by myself is very peaceful to me. So that's my ideal Saturday morning.
That's good. And Vegas has a few good coffee places that are kind of tucked away that people don't always know about. Like every once in a while, I have a patient tell me about a new one that I haven't heard of yet.
Yeah, it's great. I like Bad Owl, this Harry Potter type of place they have. That one's a really cool one.
You know, I didn't realize that was Harry Potter theme when I first went in there. I was like, this is a weird decor for this place. Plus, I haven't seen Harry Potter, so I didn't know.
Me too.
I didn't pick that up. I was like, they look owls a lot at this place.
Mm-hmm.
So as far as with your specialty, a lot of people don't know it exists. And I find that that's a big deal for a lot of our patients. And I've had conversations with female patients and they'll tell me either they were referred to a pelvic floor PT or they'll tell me some symptoms that they're having. And then I'll say, hey, maybe you could go to a pelvic floor PT. But they don't seem to even know that that's a thing. So I think that as far as public knowledge goes, it's not commonly known that there is someone you can go to that is not a normal urologist or gynecologist for a lot of these issues.
Yeah, and that's so important to bring up because even just in the orthopedic setting, and I see this all the time with my non-pelvic floor patients, and I saw it at ActiveRx. So, that's why I kind of started doing some pelvic floor at ActiveRx, just because patients will come in telling me, I have this back pain and I've had it for, I don't know, decades. And I'm like, okay, when did you have kids? What was the technique you had kids? And then we kind of dissect that, and then I ask, are you having incontinence, or do you have a lot of urgency, which means that you don't have to use the bathroom and then suddenly you really have to run to a bathroom. And usually I'll find a couple of things that seem to connect. I've read some research regarding force transfer and how sometimes when people have low back pain, they need just more efficiency of their force transfer. And the force transfer needed to give you that closure during activity and during movement sometimes can be the same thing for incontinence. So a lot of the time, back pain can go with pelvic floor issues, bladder pain and pelvic pain. Sometimes a lot of things just end up being connected. But we're doing our best to market. I just came over to the southwest part of town, over from Henderson, just because there were two of us pelvic floor PTs over there. So she was mentoring me a bit, which was awesome, super helpful. And then I eventually said, all right, I get it. Let's spread out. Let's get more people in and, make this bigger because Las Vegas needs it specifically. We don't have very much of that here, and we're really trying to grow it. So doing our best on the marketing.
That's good.
And we've actually... Oh, I was just going to say, we actually have now, a couple of us within Select, myself included, have done the formal training on treating male pelvic health patients. So I'm ready and I'm excited to start treating those patients as well. And I think that they also don't have a lot of knowledge that this exists either.
Yeah, I totally agree.
So what are some things that you find in your practice that you wish more people knew about? For example, like besides, that pelvic floor exists, but what kind of things should people go to a pelvic floor therapist for that they're commonly seeing in their, or symptoms that they're having in their life?
That's a really great question. I would say basically just these voiding habits that people get into. When you've had pain or discomfort for so long, a lot of this ends up being behavioral. So say if somebody has pelvic pain, or maybe they have endometriosis, which ends up being a lot of scar tissue in the abdominal pelvic cavity, which makes the bladder not so happy and sends a lot of urgency signals up to the brain. sometimes it's pelvic floor tension that causes it, but that urgency, that quick sense of having to run to the bathroom, sometimes people will train themselves into these habits of, going just in case, going every 20 minutes, going every time you think of a toilet or pass the toilet. And that trains your bladder not to fill up efficiently. It trains it to let your brain know, okay, you're at 25% full, run to the toilet. So a lot of it is just education is heavy, and breaking out of these habits is really important. So pelvic floor therapy, I would say the main difference between the rest of outpatient orthopedics with pelvic floor therapy is that pelvic floor is a mental marathon. It's something that you have to think of it every single time you do your daily activities. When you go to the store, you have to think of, am I doing a timed voiding schedule? Was I told to think about pelvic tension? And if I'm walking around like I'm squeezing something, things like that. A lot of it is just habit and behavioral training. So that part it's a whole different kind of challenge, I think.
What about someone who's pregnant? Is that something that you recommend that everybody should go see?
I absolutely do. In some countries in Europe, they actually just do that routinely. When you have a baby, you go to PT. It's kind of the same idea. If you think of when somebody gives birth, their perineum descends and the baby has to move through the vagina. So if you think about how the muscles need to move and relax and allow a whole baby to come through, of course somebody's going to need to rehab those muscles after that. Your transverse abdominis and your pelvic floor spend those 9 months expanding and oftentimes getting inhibited. They're at a whole new place with a whole new tension. So it's going to take some training and some mental practice to kind of remind your brain, hey, this is where these muscles are, especially if there's any complications with delivery, like such as a tear. Just like if you had a tear anywhere else, or you had, a surgeon cut anywhere else, you're going to have PT after because the muscles, and you need to rehab things to get them back to how they were before. So I absolutely think at least an evaluation should be happening after every delivery. And I do treat pregnant women as well, pregnant women with back pain, SI joint pain. Those are the people that get that laxity of the ligaments that causes them pain. And I just help them through hip pain, swelling, whatever other conditions they have. I've done my training in pregnancy as well. I actually love treating pregnant patients. I wish that I had more. And yeah, I'd recommend it for all of them.
So how do you normally get patients? Since that's not as known of a profession, how do people know to walk through the door there?
We market to different doctors. So we go on lunch marketing meetings with physicians and just kind of tell them what we do if they don't know. Sometimes it's a matter of just talking to them about insurances if they do know what we do already. Just introducing ourselves. Sometimes we talk to them about the research if they're not totally sure, why would you do this? Why do you guys use this technique? Is this something I should think about using for my patients? And we just kind of explain to them what we've seen, what we've read, what we've done, our experience with that. And we market to OBGYNs, sometimes GI doctors, urologists are another big one. And I want to talk to more proctologists, and I really would like to get some nutrition specialists involved too, because I've just seen it so much that people have different tolerances for certain food, and I just know it relates to their pelvic pain, but it's not totally in my scope to get real specific on it. So I would like to work a little bit more closely with some nutritionists.
And tell us a little bit more about that relationship, right, with pelvic pain and, all those, you have multiple systems that go into our abdominal system, we'd say that, and that has a very close correlation of, what's going on inside your body. So can you kind of speak to some things about like GI issues and how you treat that, or in general, how you work with that with the pelvic and pelvic floor type stuff?
Sure, yeah. So if I have somebody that's, let's say, having constipation, a lot of systems go into constipation, and I cannot truly change how their autonomic nervous system works, right? I can't change their upper GI system, but I can show them some abdominal massages to kind of encourage things to move. And then I also will check out their pelvic floor tension. So if there's somebody that has a pelvic floor spasm, because history of constipation means that they might have spent a lot of time straining. So giving that nice Valsalva and pushing as hard as they can, that really strains the pelvic floor, which causes other things to tighten up. So obturator internus, that's a muscle I internally will work on. Pelvic floor itself, sometimes muscles of the hip. I'll release the tension in whatever muscles that need it, especially the pelvic floor. And then the other big thing with that is called a paradoxical contraction. So sometimes people that sit on the toilet to make a bowel movement and they push, what happens is let me show you on a model, but so this is kind of the more superficial or external part of the pelvic floor. And this is that external anal sphincter. So all of these layers of muscle, which kind of collectively sit almost like a hammock at the bottom of the pelvic outlet here, as they contract, they move up toward the head. As they relax, they kind of come down, relax and release. And when we make a bowel movement, they need to come down and kind of release so that bowel material can move through that and make its exit. But sometimes people will have what's called a paradoxical contraction, where they go to do their push, which is that relaxation. It's that release that's supposed to move the bowels out. And what will happen is they actually tighten up like that first, and then they incompletely will do the relaxation for the push. So if the actual outlet itself and the muscles that have to do with the outlet are not working correctly, that's really my part that I help them with. And then I'll give them some general education on nutrition. So fiber types, different consistencies of stool, what to look for. I might give them a bowel diary so we can track how many bowel movements are you making a week, what's normal, what's abnormal, what should you look for, and report back to me. And then if it's something that's out of my scope or something that I just need a little bit of help on, I'll call a doctor or call whoever that I need more information from. But usually it's not. Usually they've seen the GI first and then they come to me anyway. So that's not really so much of an issue for me at this point. But so much of it is education, because again, there might be patients that say, you know, oh, I only go every 3 weeks. I only make a bowel movement every 3 weeks, but it's been that way forever. And that's not normal, but a lot of people don't know these things because we don't have a lot of people to talk to about it. So there's just a lot of misconceptions out there about pelvic floor. Another really important thing that I would like to tell you guys and tell anyone who's interested in pelvic floor or how it works or what does it mean if you leak. I kind of talked about how there's 2 different types of incontinence. So stress incontinence usually is more of a hypotonic type of pelvic floor, one that doesn't have enough tone to kind of hold up against pressure as we cough, laugh, sneeze, jump, that kind of stuff. And then urge incontinence is more where the bladder's not able to fill quite all the way without telling you to go run for the toilet. And, you know, that's painful, that's uncomfortable. Those are 2 different types of incontinence. Sometimes you can have what's called mixed incontinence, which is you're having the leakage with the cough, laugh, sneeze, jumping, and you're also having it before the bladder's full. Maybe you just drink like half a glass of water and suddenly have to run to the bathroom, that type of thing. So that often is caused by a hypertonic pelvic floor. So the pelvic floor is not actually relaxing enough. What happens with a lot of people that know they have incontinence, but they're not really sure why, they just know it, oh, incontinence is related to pelvic floor, you know, Google told me that, or somebody told me that. A lot of people will go to, okay, I'm gonna do 1,000,000 Kegels. So they'll squeeze their pelvic floor up and down and up and down and up and down all day. I don't know if they're holding it. I don't know if they're doing it correctly. A lot of times if that urgency is involved, that hypertonicity, doing holds and endurance holds, those ones where you don't let go, holding for 10 seconds or so, a lot of times that will make matters worse. So I really hope that in the future I can get more patients before they've kind of been told, try a bunch of Kegels first and then find out what else to do if it doesn't work. I just want the pelvic floor evaluation to be kind of the first line of treatment, and then let's get some exercises.
It's probably a better way to go do that, to go see what you need first before you just start trying random exercises.
Yeah, and it's so difficult because I don't think everyone knows that they can go to someone or that they can tell someone. I don't know if all doctors know either, so I'm not sure. It's hard, and Google has a lot of stuff. I feel like when people have issues with body parts that they're not super comfortable talking about, the internet is the first place, and there's just so much on there. Not PT.
It sure is. So we work with athletes a lot in our profession. Do you work with a lot of patients that are athletes, or do you notice common issues that seem to be related to somebody that is, obviously doing the jumping and running and the things that you're talking about, or even weightlifting?
Yeah. So I wouldn't say I work with a lot of athletes, but they're definitely some percentage of what I work with. I have worked with athletes, and I do sometimes. With athletes, probably the most common diagnoses I see would be pelvic organ prolapses. So those are very common. Oftentimes it'll present as a problem for a woman postpartum. So after carrying all that baby weight on top of their organs, which I have, there you go. There's your beautiful bladder, uterus, and rectum right there. So these sit in the pelvis, and then the uterus is going to expand like this really big and put a bunch of weight down on the bladder and the rectum. So for those 9 months, you're moving, you're growing, you're changing, your muscle tone is changing, your ligamentous support is changing. So that can end up being a lot of weight on things. It can contribute to constipation, and sometimes that will contribute also to pelvic organ prolapse. So after women have a baby, if they're complaining a lot about pelvic pressure, or sometimes it'll even contribute to urinary retention, I'll want to look and see if they have a prolapse. So that just means that their bladder, rectum, or uterus is kind of pushing down toward their vaginal canal, and they're feeling that pressure and it doesn't feel good. I'll have people that are postpartum and now they have this ligamentous laxity. Their core doesn't fire quite as automatically as it used to. And if there's someone who's running, with every single time they hit the pavement, they're feeling that pressure, that's probably a big diagnosis that I see, kind of similar to diastasis rectus. So after having a baby, there will be a totally new tension on your diastasis, and it's not that it's broken or not going to work anymore. I explain that a lot because people kind of get nervous about it. It's just there's a new tension on it. So now you have to learn how to move with it and fire it where it is. So
what's your diastasis so people know?
What'd you say?
What's your diastasis so people know?
Oh, okay. Diastasis rectus is, if you think about, I'll kind of trace it on myself. If you think about the rectus abdominis, which are those long kind of six-pack muscles, underneath that you have a transverse abdominis, which connects almost all the way to the spine and then connects to the spine by connective tissue, and it wraps deep all the way to the front, and then it connects right in the middle at this line that's called your linea alba. The rectus abdominis will be on top, and your obliques and all of those kind of bigger muscles on the outside that are more beefy will be on top. And during pregnancy, because that uterus is expanding and it's putting that forward pressure, what happens is the transverse abdominis, rather than being kind of tight where it connects with that linea alba, it's snug like this, it ends up maybe being somewhere like that. So the tension on it just kind of changes. And the rectus abdominis that are parallel, kind of connected at that linea alba, sometimes those will also have that split. So women will usually complain about symptoms of, they'll say, I just feel blah, or I just feel like when I move, everything doesn't go together, it doesn't feel right. So that sounds really vague, but usually if they've had a baby recently, that's kind of where I go, that there might be a diastasis there. So that'll be a big complaint for someone who's an athlete. They like to move and they want to move. It doesn't feel the way that it used to. So sometimes there can be a lot of nervousness or worry about that after having babies.
Yeah, we've noticed that with some of our athletes too that seem to have that as an issue. They have a really hard time like collecting air and keeping it in. So if you're trying to like pick up something heavy or weight from the floor, they have a really hard time like bearing down and creating inter-abdominal pressure because that system's a little bit off.
Mm-hmm. Yeah, and I'll teach women how to use their transverse abdominis and their pelvic floor with their breathing, independently from their breathing, and just teach them exactly where it is, and that I really want it to be kind of that first muscle that fires every time that you move. So kind of just training it that way. And the APTA pelvic floor, or women's health section, actually, I think they're changing the name to pelvic floor, but the women's health section posted a research article on that, I want to say about a year or a year and a half ago, and they gave this whole protocol for treating those diastasis rectus. So that's been really, really helpful. A lot of the time, these pelvic floor and abdominal diagnoses of those deep core muscles, basically, a lot of the time, it's just learning where they are and how to use them. And that can be really important for people, just kind of finding them. So for some people, you get lucky and it's very quick. It's just they didn't know how to turn that on before, and now it feels differently. So that's kind of a lot of what I do is deep core. I would say multifidi, TA, pelvic floor, and respiratory diaphragm. I just look at how all those are moving, try to facilitate them with the movements that hurt, and see if it feels different. And it usually does feel different. It usually does feel either better or worse. So that'll be a good starting point for me.
And one more thing too, the things you just mentioned, we've heard people commonly say that that's with the athletes that we see in the CrossFit gym. The other thing is girls, when they do double unders, when they do the jumping and landing, then they always have trouble not peeing themselves. And that's also a common thing that I've had people tell me.
Right. I have not worked with, I don't believe I've worked with weightlifters for the pelvic floor, but I would love to get some more in, because I've read about that too, that can be very common in women who weightlift and women who jump a lot for sport. I know that a lot of the time too, they might be even aware of their pelvic floor, and who knows, they might do Kegels at home. They might do whatever they think they're doing to strengthen, but a lot of the time women don't actually need strength. Their strength is good, and if I put my finger inside right on the muscle and I say, okay, pull up, squeeze it, they can give me a good squeeze. But it's more of a matter of how they're using those muscles when they're moving. That's kind of, sometimes it doesn't always carry over to that. So coordination and endurance are usually the two biggest things that most women need, but sometimes they need strength, but not most of the time.
Yeah, and to speak to that a little bit more too, is it's like you use the word common, and it is very common, but again, it's not normal. So that's always something that we always like to tell people, because if that's occurring to you, Antoinette, or myself too, I can do a little bit of the screening portion, but if it's past what I can do, I always send it to Antoinette, hands down.
That's such a great point. I'm so passionate about this, but that is such a great point. So there's so many women that will tell me, I'm 68. I've been leaking since I was 23, but I'm a mom, so I leak. And I'm just like, you don't have to. You don't have to. Let's look at it and see if we can do something about that, or I'm postmenopausal. Sex should hurt. That's supposed to hurt now. Or I'm pregnant. My back should hurt. I'm going to be a mom. So I would really, really love if people didn't think that they have to be in pain because of their other roles,
If people do seem to justify why something's going on based on their activities or how they identify with like what they do. They're like, oh no, like I pick up heavy things from the ground. Like my back should feel like somebody's stabbing me with a knife. I'm like, well, do you want it to? Like, you don't really have to. Like, sometimes there are better options out there. And I'm glad that you're getting the word out.
Oh, good. Thank you. I'm sure it's the same with a lot of the things you guys see. People have jobs, or if they're even just athletes that have been using the same technique forever because it's always been their go-to, and now suddenly it hurts a lot. I'm sure you guys kind of think of, what muscles are you overusing? What muscles are you not using? What muscles have you never heard about? Or ever used, and you kind of just go from there and see how things feel.
Oh yeah, for sure. So what's your favorite cheat meal? We're going to change gears here. Talk a little bit about food.
Oh my gosh. My favorite cheat meal. Is sushi a cheat meal if you eat 35 of them? Probably, yeah. Probably sushi.
That's another thing about Vegas is that they have tons of sushi restaurants out here. An
So
absurd
many.
amount. Yeah, an absurd amount.
Yeah, so many. So there's so many sushi places here. I don't think there's nearly as much sushi as where I come from. There is more kind of, I miss cherry stones, clams, so raw stuff, raw. They're not I'm not a huge oyster person, but they have these cherry stones that are really big. They're kind of like big little necks. I like the raw stuff over there that I would probably never eat here because I'm like, I'm in the desert. I'm not about to eat an oyster in the desert. But here, I'll say the sushi is phenomenal. I didn't really eat sushi at home, and now can't even get off the stuff.
It's rather addicting. It really is. So what's something that you've learned that you wish you knew sooner?
I wish that I knew that you don't always have to have 100% of the answers 100% of the time, and that you should utilize your colleagues and don't feel bad about utilizing your colleagues. Because I remember that in PT school, they teach you about our 4 systems: musculoskeletal, neuromuscular. What are the other ones? The integumentary, which I don't use that one a whole lot that I know of. And then what's the other one? Cardiovascular, yeah. Okay, so they teach you about those 4, and then they teach you about all these pieces of these other systems. I don't really use those all the time. So sometimes stuff will feel new to me again, and I'm thinking like, I should know this. This was from school, and at the time that just seemed like so much, and it is so much. But now I have people that I ask for help if it's a neurodiagnosis that at one point I did learn about, but I haven't seen it in a bit. Ask for help, get some suggestions. It'll make you a better therapist at the end of the day. It'll be better for your patient. So I'm glad that I know a lot of really good people in Vegas, and we can help each other.
Oh, for sure.
So what's something that you've been working on professionally, personally, physically, or mentally? Just something that you're excited about.
Something that I'm excited about working on?
Yeah.
Besides my job. Well, I'm really excited about my dog. She's getting so big.
I love it.
She's getting so big. I went on a trip last week and she stayed at the vet for a week, and it was really sad for me to drop her off at the vet for a week. It was really heartbreaking, but now we got her back. She's cleaner than she's ever been. I don't know what they were washing her with, and she knows how to bark now. So
That's good.
yeah, she was having like these baby puppy barks, and then she's about 16 months, I think now. She was having baby puppy barks, and now she's roofing at me. So I'm really excited about her and watching her grow up into this big, beautiful, fluffy dog.
I love it.
That's good. What's something that you commonly see in your practice that you wish more people knew?
We've actually covered a lot of it, but I wish people knew that you don't have to have pain with intercourse, and that you don't have to be ashamed of pain, because I think pain with certain activities and in certain areas of your body is overwhelming and scary and embarrassing and anxiety provoking for some people, and that ends up affecting their health in other ways. So even back to just the incontinence thing that we were just talking about, if people feel like they're socially withdrawn, or they're not comfortable going to family cookouts anymore, or doing the activities with their friends that they used to do for fear of leakage or that discomfort, they might end up being more sedentary, which is going to impact them psychologically and in other ways, always. So I just mainly wish that people knew that there's somebody to go to talk about your pain, and there's somebody that wants to hear about your pain, you know. Don't stop looking. If you're not sure where to go, ask your doctor. Hopefully we'll get to more doctors so that people don't have to be overwhelmed.
Oh, for sure. And what is something that you want to leave the listeners with? I guess that last statement was pretty good too. But
Well, thank you. I want to leave them with just knowing that, well, first I want to say thank you for listening to the interview. It means so much, and thank you guys too for interviewing me. The more that we can get education that pelvic floor physical therapy is out there and what we do and what we can help with, the better. So I want to thank the listeners for listening and not getting sick of us. That's fantastic. And ask for help if you need it.
And how do people find you? So
How
would somebody find you if they want to reach out after watching this? How would they find you?
Oh, okay. So do you want me to give my email address? I can give that.
Sure.
My email address is agagliard@selectmedical.com. And I've given you my business card, right? So will that be posted somewhere?
Yep, we'll have them on the show notes. So the emails
great.
will be on the show notes.
Perfect. So that has my name, my email, and then the number to my specific clinic, which is in the southwest part of Las Vegas. There's a couple of us all around Vegas. I want to say, I hope I'm not wrong, 6 or 7 of us, something like that, all spread out. Not everyone treats all pelvic health, and not everyone treats men. So that's the only difference. Not everyone treats men, but yeah, we're all willing to help, and we're kind of spread out. So hopefully if you're in Las Vegas, you won't have a problem getting in if you need to or want to.
Well, we definitely recommend you, Antoinette. You're one of the kindest, most gentlest, most genuine people I've ever met. And I'm not just saying that, I really mean that. So anyone watching this, if anything that she's talked about today seems familiar or descriptive of things that you might have, I definitely recommend checking you out.
Thank you so much. That's so sweet. And thank you guys again very much for having me. It means a lot.
Thanks, Antoinette.
Thank you.
Thank you, Erica.
We'd like to thank you for listening to La Vida Las Vegas podcast. We hope you enjoyed the time with our guests as much as we did. It would help us out so much if you could share, subscribe, or review our podcast or any combination of the three. Thanks again, and remember to take care of yourself.